when they talk, or maybe in the chat, if you do something in the chat, just say where you're from. So because it doesn't always show where you are from. So I'm Linda Frankland. I'm the Deputy Finance Director for Sirona. Sirona is a community interest company working within Bristol, South Gloss and North Somerset ICB area. So we're the community provider. So work really closely in our system. So it's really nice. There's quite a few of you I think I know from various things. So nice to see you. So I think what we're covering today, we've got Richard Sawyer talking about the EVO framework and what's that all about. So that'd be interesting. And then we've got Charlie with the regional update, and then AOB. If anybody's got any AOBs want to put in the chat, that's fine. We got Richard here. Just
yeah, he's on the call.
Oh yeah, and I can see you there. So should we, given it's we're nearly in 5 minutes in, so I don't, should we hand over to Richard? Yeah.
Hiya.
Nice to meet you.
Yeah, hi, nice to meet you. Just having a few technical issues with my presentation. If you could, wouldn't mind playing foil for a minute while people join, that would be fantastic. Apologies.
Absolutely. Yeah, no,
just
we'll
trying
let
to connect to a screen. Thank you.
Let you get that sorted. Yeah.
If you want, Rich, I'm happy to go because my presentation is only 10 minutes. If it's going to take a couple minutes, I'm happy to pop in if that's helpful.
If that's all right, that would be lovely. It's the wonders of the Finance Innovation Forum and technology, isn't it ironic? Yes, that would be great. Thank you.
No problem. Just give me 2 secs, everyone, and I will share my screen for you. Just bear with. Lovely, there we are. So hi everyone. I do recognise most people on the call, but just in case you don't know me, I'm Charlie Spicer. I'm the Programme Manager of the South West Finance Academy and the South West SDN. So I thought I'd just kind of do a brief update and touch on a few of the areas that we haven't run through before in these sessions. So we've kind of gone through what the Finance Academy offers, what it is, and recent updates. So I thought I'd do a bit of an update on things you might not have heard of as of yet. So I thought I'd start with the Insights Placement Scheme, and I can see Cloud is on the call, who's a great help with this. So I know some people may have heard of this, but some may not, and I've had a couple of emails as well of people asking kind of what's the latest with that. So I thought I'd start with an update on that. So if you don't know what the scheme is, the NHS Finance Insights Placement Scheme is a national scheme that offers paid work experience in NHS organisations in the finance departments throughout England, and this is for individuals aged 18 and above, so that year 13 kind of age, if they don't plan to attend university and if they come from lower socioeconomic backgrounds, so if they've been on free school meals in the last 6 years, or if their household earner is under a certain amount, so giving opportunities out to people who may not have considered a career in NHS finance or may not always have those opportunities presented to them given their background. So it's a 12-month paid placement experience at an entry-level finance role, so band 2, and it allows candidates to develop new skills and gain on-the-job work experience. So how we're running this in the Southwest. So the scheme does operate across all 7 NHS regions in England. This includes the Southwest. And given the geography of the Southwest, we're currently piloting it in Bristol just because of transport links and population and things like that, just to see how it goes. But we do have a view to expand this across the Southwest in the next 12 months. So there are 4 placements available in total across Bristol, with 2 placements available at NBT, so North Bristol NHS Trust, and 2 placements available at University Hospitals Bristol and Western NHS Foundation Trust. And as we've gone through this process, we've kind of learnt what are the best times to reach out to schools, how this might work, and we're kind of still working through those practicalities. As I say, this is the first time we've done it and it is a pilot. But following on from that, we're hoping to roll it out across the rest of the BNSSG system, so the other organisations within that. And then we're hoping to do it across most systems from September, but we do understand the geography of places like Cornwall and Devon are a bit more tricky. So we will see how that works. But the aim is to have it across at least 1 placement across each of the systems. So really helping the local communities there. So the kind of stage we are in now is we've promoted the scheme across all the schools and colleges in Bristol and the area just outside of Bristol as well. So this has been done through emails, phone calls, flyers and brochures. They've also been the flyers and brochures have also been put in gyms, barbershops, things like that as well. And colleagues in the BNSSG system have been attending career fairs and presenting at schools to some of those students. There's also been recently a national webinar, which was available to prospective students, teachers and parents, and that's also available on the website. And the deadline for applications is Friday the 24th of May, so that's actually next week. So if anyone was interested in helping and had any connections at any local schools, or their children are at schools in Bristol and the surrounding areas and wanted to promote this, I'll circulate the slides obviously afterwards as well to you all, because there's a few links with those pictures there. That would be great to share information. Do feel free to pop me an email if you wanted to learn more, or if you wanted to discuss how it might work going forward in your organisation. Happy to have a chat about that. So that was the first one. And then the next thing I wanted to touch on was a couple of upcoming equality, diversity and inclusion events that we've got coming up. So I had touched on before our EDI strategy. I think we've gone through that in a previous meeting, and some of the research we've done on EDI in the Southwest. But as part of that strategy, we vowed to put on relevant events and training for colleagues across the Southwest. And this wanted to be free of charge, so it's accessible to lots of people. And we do have more coming. And we will actually be hosting our first annual EDI conference for the whole of the Southwest in the autumn. So that's really exciting. And when I've got more details on that, I will share those with everyone, and I'll probably at the next meeting update on that as well. But I thought I'd just bring your attention to a couple of the ones that we've got coming up now, and these are already available to book onto. So we're trying to ensure that one person in each organisation is represented on these events and training opportunities. So firstly, we've got a training event on inclusive interviewing. So obviously this is particularly relevant for those colleagues in NHS finance who are in hiring positions and in positions of management. And some of the objectives of this event are to have a greater awareness of the impact of bias within the interview process, and to go through ways to identify and mitigate bias within the recruitment process. Then secondly, we've got a disability inclusion training session. That one's kind of like a lunch and learn session. It's just 1 hour long over a lunch period. Colleagues during this will understand, they'll have a greater understanding of the models of disability and how we can reduce barriers for disabled people in our workplaces. And then lastly, we've also got a session on supporting racially minoritized colleagues, which will focus on the inequalities they face, how you can actively challenge racism and in professional and personal situations, and also learn strategies to help remove barriers for these colleagues. So again, I will circulate these slides, and there's a link on each of these images to sign up, and I'm happy to pop out an email with those. They are mostly aimed at our inclusion and diversity ambassadors, as we do have one in each organisation now, but they are open to more people as well. So if you did want to find out more, do just, I'll put my email in the chat as well, do just pop me an email. And then next, I know some on the call are very familiar with this, but I did think some may not be. So I thought I'd just quickly touch on the Skills Development Network. It made sense to run through the training opportunities within this, as it's just launched its programme in the last month for the next year. So if you don't know what the SDN programme is, it's a subscription-based network. So it's dedicated to providing training to NHS finance and procurement staff within the region. It provides opportunities and training to enhance technical and personal skills. It runs on a 1-year programme, so it runs from April to March. And it provides all the relevant opportunities that work at the organisations who are subscribed to the network. And the opportunities are informed through colleagues and what they've asked for and the success of previous events. So just some highlights from the 24 to 25 programme. We've got a new Igniting Talent series in finance and procurement. So that's kind of a development programme. We've got some technical skills such as VAT, Excel Essentials, that goes through intermediate and advanced. We've got some Power BI training, SQL training, and then there's also all the softer skills. So we've got presentation skills, how to write good reports, time management, resilience, etc. So there is something for everyone on those. And we do have more events than ever on this programme. In fact, it's 20 more than last year. So it's very ambitious, but we've actually already put one more on because one of the Excel courses was so popular, we've popped it on another time. And then how do you book on? So obviously your organisation needs to be subscribed to the network, but there is a pay as you go service for if there is something you're interested in and your organisation isn't subscribed. And then to book onto the sessions, you just need to visit the One NHS Finance website. If you click on the little events button, you may need an account. So if you haven't logged in, you will just need to log in. And then it comes up on the tab Skills Development Network with all the ones in your region. But if you do need any support, do just pop us an email and we can sort that all out for you. And then I just thought I'd pop these in. These are a couple of the upcoming events. So we've got SQL Foundation. There's also an advanced and intermediate course on that. We've got how to excel in a new NHS role. So for someone who's perhaps just moved into the finance department or is new to an organisation. We've got tender evaluation training, inclusive recruitment and managing diverse teams, handling multiple demands on your time, strategic thinking for finance and procurement professionals. And also we've got an AI session that people asked for. So there's lots on there, hopefully something for everyone. And I will circulate the link to that. And then I thought I'd just give an update lastly as to what's upcoming over the next couple of months. And then I thought I could provide an update on these at the next meeting. So we are in the process of pulling together the talent management report. We have spoken before, I think, about what the talent management strategy is, but happy to pop that in the chat and run through that. But that report is just a temperature check as to how we are as a region, how we're comparing to nationally to kind of how other regions are doing. And this is mainly to assess what support we can give to those senior colleagues, but also colleagues in accessing talent management support, how to have those talent management conversations. So this is mainly to see what we can support specifically in the Southwest to help the success of that. So that report will be submitted in early June. So we're just in the process of collecting the organisational responses for those. We've also got some new interview coaching sessions launching soon. So this will be for staff who are obviously still applying within the Southwest in NHS Finance. And this is kind of on an ad hoc basis. They can go through the role, the job description, how to interview well. So I think that'll be a really helpful one in terms of helping our retention across the Southwest. We're also launching the Health and Wellbeing Network. So this is at the end of the month. And as part of that, we will have mental health first aid training available to health and wellbeing champions. And in our first meeting, we're going to discuss the action plan as to how we can support wellbeing across the Southwest. We're also continuing to support colleagues access our sponsored opportunities, so coaching, qualifications. We're looking at how we can support with some of those accountancy exams as well, and if we can provide support with that. We are also publishing some more career stories. We've got some blog posts coming up on protected characteristics, and we'll also have a revised and refreshed strategy for finance staff development in the Southwest. So this is the strategy that the Southwest Finance Academy works off, and we thought it was time to refresh it, make sure it's in line, and that we're offering everything that people in the region want. So that was everything that's kind of coming up over the next couple of months. And then I've just popped a last slide again. I'll send this out with links to all our social media channels. You can stay up to date via there. And we also do have a newsletter that sends this kind of information out on a monthly basis, apart from the month of April due to year end. So you could, all it requires is just popping in an email address. So if you wanted to stay up to date with everything, or you wanted someone in your team to stay up to date with everything, you can just subscribe to that. And I will circulate the slides after this. But if anyone's got any questions, I'm happy to take them now, or I can pop my email in the chat, and I'll take anything offline as well.
Thanks, Charlie. There's some fantastic stuff there. Has anybody got any questions about any of that? Can't see any hands, but yeah, look, a really good selection of stuff available for people. So we need to get it out there, don't we, to people? So yeah, that's great. So yeah, thank you. So
okay, thank you. I'll pop those out after this meeting because they've got a few links on, but I'll pop some of the bits I mentioned just in the chat as well if anyone wanted to have a quick look at them sort of during this meeting. Yeah,
thanks a lot, Charlie. So okay, so Rich Richard, have you managed to sort out your technical problems?
Yes, I think I have. Thanks, Linda.
Fantastic. Well, we're all with you. It happens to all of us, doesn't it? So yeah, I'll hand over to you.
Thank you very much. Thanks very much for having me, everyone. Lovely to see some familiar faces today. So I'm going to talk to you for about 20 minutes, half an hour, and try to explain what EVO is all about, as the agenda item suggests. So in short, this is a framework that any trust can apply to have. It gets posted to you. That's about this thick. And ultimately, it gives you and your teams the tools to make clinical transformations at specialty and service level, and ultimately measure sustainable improvement in that way. I'm going to talk for about 10 minutes on using the analogy of space exploration to talk about the process itself, which is a 24-week process. So we'll go through that. Then I'll pause for questions, and I'll do another 10 minutes and get into a bit more of the detail and go through 3 value tools that teams will learn to be able to use themselves in the trust, which ultimately produce an output, which we're calling the Value Impact Comparison Score. And that comparison score will go into a transformation statement detailing all the great work that the teams will have completed by that process. So there's a quantitative output here that you're going to be able to use to articulate not only the quality improvement that your decisions have led to, but also how that impacts the productivity and efficiency of those services as well, which is something that is really needed at the moment to be able to help you guys articulate all the great work actually you're already doing. Not a lot of new stuff in here, but it's about giving you a way to demonstrate that through the VIC score. So just going to share my slides. Linda, if you could just give me a shout if once you can see them, then I can crack on, if that's all right.
Well, I can see those, yeah.
Delightful. Right. Don't need the title slide, do we? Right. So, okay. So ultimately, what is EVO? So the ultimate goal of the framework is to help teams improve patient care at the system level by supporting evidence-driven, value-based decisions at the specialty and service level in organisations first. And I'll talk a bit more about the system element if we've got time at the end. But as I've said, the framework itself takes the form of a free of charge physical project management handbook. It's about this thick. Trusts will be posted this on completion of a successful application. Any trust can submit that application. It does require the medical director, the director of finance, and the trust board to sign a commitment statement for EVO. And what this does, and why we've not just sort of distributing the materials across the country without application, is a lot of this good stuff, a lot of teams and individuals want to be able to start doing in terms of clinical transformation, but it's finding and protecting the time and feeling they've got permission to spend time on the important stuff like this. And a lot of people are suffering from not enough time to be able to prioritize this stuff. So what the application process does is there is a schedule of dates across a 24-week period, and it appeals to the trust board to back and support essentially the schedule for those 20 weeks to allow those individuals protected time to work on the framework itself. So the handbook itself and the contents of it, EVO is delivered by all existing operational project improvement and costing staff, and essentially to evidence the need for change using the data available broadly. For this, it's going to be using PLIX data for the purposes of improvement. Now, there are no external parties involved in the process, and the trust teams are created and empowered to make decisions, implement the changes, and for the first time, as I've indicated, they're able to measure the impact their clinical transformations have had in terms of value. The focus for this is firmly on prioritising the health outcomes for patients using the resources available. So value, I've mentioned this a few times. This is defined in so many different ways, and actually as a result of this, it's regarded as a concept or theory of measurement rather than an actual useful measure itself. So through Evo, Evo simplifies value, allowing teams on the ground like yourselves to be able to use it as a practical and tangible measure of improvement. And I'll show you how that's possible by the end of this presentation. So for the purposes of Evo, basically value is going to be defined as outcomes or quality at the top there, relative to the costs or resources. So broadly, that's to say it's widely acknowledged that focusing solely on cutting costs without maintaining or enhancing the quality of care can lead to false savings and harm the delivery of effective care. So the focus is on sustainable quality improvement and brings together the sort of SIPs and cost improvement work and the QIPs and quality improvement work and the finance and clinical teams that are expected to deliver these under one numerical measure of improvement, namely the VIC score. And I'll talk a bit more about this, but I'm going to talk now just about who's involved and the process itself. So we've worked with a number of collaborators on the development of this framework over for quite a while. Some of you may know the WAVE program at Nottingham University Hospitals, clinical process groups at the Royal Free, and the waste reduction program ongoing at Leeds, and we've learned a huge amount there. And within the handbook, we've essentially assumed that sort of lowest level of capability there. And what I mean by that is that if your teams aren't confident in producing dashboards, we've worked with making data count to look at essentially part automating and bringing in the skills needed into the Evo team to be able to produce clinically engaging dashboards. And a lot of the materials, so the handbook itself is about over 100 resources that you can scan or click on the digital version to download. These are presentations, these are briefings, these are various tools running right through to be able to give your teams the skills and tools they need to be able to do this stuff. Running a project. So as part of this, there's a project management element. So if your trust doesn't have a sort of a structured PMO, if you've got an individual who's keen on running a project end to end, we've worked with the Healthcare Projects and Change Association. So they've got a lot of free e-learning and bite-sized materials that come as part of the Evo package, and essentially an individual who wants to run a small end-to-end project, say 24 weeks, can go through this process and can confidently deliver what's needed within Evo. On top of that, we've got sort of facilitation and improvement colleagues. So those of you who are QSA sites, quality and service improvement redesign, you'll recognize a lot of these tools built into the structure of Evo underneath, and a lot of these sort of principles are reflected in a lot of the Evo practices, and a lot of the resources are available through Evo as well. So I'm going to have a bit of fun's a light word, but we're essentially choosing to sort of introduce the process of Evo through the analogy of space exploration. We're doing this to sort of kindle enthusiasm and create a positive attitude towards change. If you don't like space, then get ready to change your mind. Right. So what's the mission? So Your Home Planet, an NHS trust, has submitted a successful application for a rocket exploration program called Evo. So this program will ultimately help to improve the quality of life for the population on Your Home Planet. And Your Home Planet has identified 3 areas, specialties and services, that will be the subject of the mission. And now each of the 3 areas has put forward a flight crew, and each crew will then launch their rocket at the same time into orbit around the planet. And each crew's mission is to orbit the planet they share, each observe their specific area from space together, and use the information gathered to agree on a plan to transform and improve it for the benefit of all who live and visit there. And the Evo handbook gives the crew everything they need to know in order to complete this mission. So who's taking part in this? So there's 3 core disciplines. So we've got finance, clinical, and project are needed for the mission. And we've got different tiers of roles. So first we've got the Evo champions. So they're collectively responsible for sponsoring the mission. Champions are not part of the crew, so they don't get to go to space, but instead they support from the ground. And then we've got the Evo leads and the flight crew. So the finance lead is responsible for the rocket's engines, which use data as fuel for propulsion, basically. Work with me on the analogy. And then we've got clinical lead. So the clinical lead is the rocket's captain and knows the most about the area back home. And we've got 2 project leads as well. And they're responsible for the navigation and will guide the rocket's orbit. And finally, Evo participants. So these participants are subject matter experts and are encouraged to share their knowledge with their crew to support a successful mission. Now, I'm going to take you through the process. And if we imagine that our Evo crew here have essentially applied for the rocket program and are set to learn the handbook. And what I'm going to take you through is 3 phases of the mission. So we've got the launch preparation at the beginning. We've got the Evo journey and the Evo transformation. So you can see here, this launch preparation sort of period lasts up to 4 weeks. So the Evo handbook lands, and you can see our finance lead and our 2 project leads working together there to help them understand how the rocket works, what trajectory an orbit should take, and what the crew should do in the event of any sort of unexpected variation to their flight path. And now we've got the second phase, the Evo journey. So I'm going to spend a bit of time here talking through these components. So this is expected to take 16 weeks. And the 3 crews in 3 separate rockets will take off at the launch together. They'll all orbit their planet simultaneously, and then they'll land back on their home planet together. So there are 3 stages to the Evo journey. You've got the launch, you've got the orbit, which essentially comprises formulate, evaluate, allocate, and decide and plan. And then you've got the landing finally. There's a few other elements here. So we've got the data burns. So they take place at the beginning of different stages, and they propel the rocket and its crew further into orbit. And we've got the markers or outcome markers. So these act as waypoints, and crews that use these to self-assess their rocket's progress during an orbit. And a rocket broadly that sort of reaches marker 3 indicates that its crew is on course to achieve all of its mission objectives. So I'm going to talk about what contains each of these stages. It's contained in each of these stages. So in the launch, we've marks the start of the mission. So it brings together the champions and introduces all 3 flight crews together. At the launch, crews will gain an understanding of their mission, the timescales involved, and the different roles each crew member has. And then all 3 rockets will launch into orbit. So the orbit itself takes 8 weeks and has 3 stages. So in that formulate first stage, the crew can expect to agree on 2 things broadly. So they will agree on 3 hypotheses or hunches that they think are likely to improve the area back home. And secondly, they're going to essentially agree a number of measures which will help them to assess the viability of each of these hypotheses for improvement later on in the orbit. And we'll talk to that in a minute. Remember this section because we're going to talk about the first value tool in a bit and what that contains at this stage. And then we move on to evaluate, allocate. So basically, by performing a data burn, the crew can use the evidence gained to evaluate the probability of these 3 hypotheses, agree which of the 3 markers each hypothesis should be allocated to. And broadly, the objective here is to essentially, you start the evaluate, allocate stage with 3 hypotheses, and by the end, you'll identify 1 opportunity for clinical transformation or transformation to transform your planet. And ultimately, then you will move forward to decide and plan. So decide and plan. If a crew has had a successful data burn, they've completed the objective of evaluate, allocate without any issues, then their rocket is likely to reach marker 3. And a crew whose rocket reaches marker 3, they will return back to their planet. They'll have agreed on a plan to measurably improve their area back home. And they will also have agreed when these improvements will be implemented, and they'll have a date to meet and assess the impact of the changes. Now, crews who reach marker 1 or 2, they still have a really good orbit and can expect to reflect positively on that experience. And they'll have a lot of meaningful sort of lessons to learn to hopefully improve the sort of trajectory of the next orbit that they take to reach marker 3 in the future. So at this stage, all 3 crews have now finished decide and plan. And then we've got the landing. So the landing concludes the journey, brings all 3 crews and champions back together. And once back on the ground, each crew will share their findings and discuss the lessons learned. And we've got the third phase to all of this, which is the transformation. So this will be a minimum of 4 weeks. And essentially, having landed, those crews that did reach marker 3 will have a plan in place to transform their area. So this EVO transformation is expected to take minimum of 4 weeks. It may be longer due to the scale of the change that needs to be undertaken, and it involves a lot more people back home to administer that change. Basically, after the period of transformation, after that's taken place, there will be a final assessment, and the crew will meet once more to assess the impact their improvements have had on their home planet. And we'll then spend the next 10 minutes, I'll pause here for any questions, to go through the actual detail of the tools that will be used in order to administer all of this. But I'll just pause there for a second. Linda, is there any questions or anything, or shall I crack on, or what would be best?
Well, has anybody got any questions? I love all the pictures. It must have doing all. Did you do those, or did you get?
I did.
Wow, they're incredible, aren't they?
Yeah.
Yeah. Is there any questions from anybody? Can't see any hands. Or do you want to crack on? I think maybe crack on, and you might get a question from your next bit. Yeah.
It's hard to ask a question about space travel. So what I'm going to do now is I'm going to bring it right back down to something tangible, so you can understand how you can see basically how this can be useful by the end. So got a load of finance value makers on the call. So what I would talk about now is essentially what we need to do is note that we've got the value equation back up. And for these next few tools, note that quality is in sort of yellow and resources are in red for this, because essentially what we're going to do is we're going to use the available data. We talked about those data burns, and resources is essentially all available data that is the data that is available to the EVO crews. But primarily we're looking at that PLIX data. So the PLIX information is generally updated, we would expect quarterly during that process. But that's actually not a requirement. Trusts don't have to be reporting quarterly. Trusts just have to commit to be able to press go, as it were, on their PLIX system at the beginning of this process, and then once again at the 24 weeks later. And this will allow for comparison in understanding sort of the variation that we're going to see in the change over that period and through the transformation. And I'll talk more about that in a minute. But keep in mind the value equation here, and we'll go through the first few tools. Well, these first 3 tools now. Okay, so this is the first one. If you remember, so what you're looking at here is a maternity services example. And if you remember, that first stage is called formulate, and said that the crew were going to come up with a number of measures. So what you've got here on the left-hand side, you've got your outcome measures and your resource measures, and these are value components, and they reflect the value equation. We've got the value criteria here, and essentially we'd ask the crew will ask the clinical team to describe what good looks like to them in terms of quality outcomes. For their specialty and for the purpose of this, they're going to have an understanding of what good looks like. This is a maternity service example, as I said, so you can see a number of the metrics there. And this tool goes through a process of transforming the what good looks like statements into metrics and measures. These metrics are then framed at the beginning of the process, and then we move on in this session to come up with 3 hypotheses for clinical transformation. This value measures tool is the first one that we'll use, and and we're then going to move forward with these different hypotheses and look to use these to assess and measure the effectiveness and appropriateness of the different options for clinical transformation. So with our maternity services crew here, if we imagine that we've got our 3 hypotheses, we've done our data burn, we've gone through our evaluate allocate stage. So actually where we are now is the beginning of the decide and plan stage, quite near the end there. And our crew have an opportunity for clinical transformation and have gone through that process. So we've got an opportunity for clinical transformation. What decide and plan, that's session 3, is all about, is beginning to go through and assess what are the different options that are available for tackling that opportunity for clinical transformation. And I'm going to take you through a tool that will take the team through that, the crew through that process. Okay, so we can see here we've got our I wonder if I can do this on the screen itself. Yes. Okay, so we've got our quality outcomes, we've got our value metrics, and they've been prioritized here, and we've got our resource metrics as well. And we've weighted here, and those of you will notice, essentially, we suggest a weighting of 80% quality and 20% resources and cost, and maintaining that weighting throughout. This is obviously completely customizable by your teams. I won't go into the suggested format of that weighting, but this is what we would suggest for the purposes of Evo. Again, it's yours, so it's your decision how you approach that. What we have also is we're entering in risk factors and strategic factors within this assessment of these different options for transformation. And what we've got here in this case, we've got 5 different options for tackling this opportunity for transformation. And these are the 5 verticals you see here. So what we can see is we've got a Likert scale. So that's 1 to 5. And broadly, what you can see, our team is going to go through these value metrics. And ultimately, what we're seeing is 5 demonstrates clear and measurable value generation, low risk of failure, and full alignment with strategy. And 1, obviously, the inverse of that. So unclear or poor value impact, high risk of failure, misalignment with strategy. This is actually an Excel tool that we've built. All the instructions are built into as one of the resources within the handbook, and teams can follow all those instructions to operate and look at the outputs. Now we can see from this that our team has identified that option 2 is the most appropriate, and there's a lovely graph there so we can see it visually for our clinical colleagues who prefer graphs than rows and rows of spreadsheets, don't they? Right, so this is the end of option 2, and essentially the remainder of this session 3, teams will review their progress, and they'll also agree a schedule for the upcoming transformation stage. And most importantly, a final meeting at the end of that month or 6 weeks or whatever that looks like, to meet and assess the impact of that transformation once it's carried out. Now, the next tool I'm going to show you is the value impact comparison tool, and that's going to be operated at that final assessment. So what's happened in between is trusts may have different change models that they adopt. PDSA is a very familiar one, and we're not touching that. If trusts will have their different safety and risk measures that they need to meet, and clinical transformation is a due process. So whatever that is as standard in the trust, that is the one that we would suggest going with. If for whatever reason a trust doesn't have an improvement cycle or structure like that, there's an entire PDSA out the box tool that have been shared with us by CUSA that is available as a resource, and trust can use that. All we would say is over that month, that 6-week period of transformation, all sites operate a sort of PDSA, or we're calling PDSA plus model, which is obviously measuring that PLIX information during time, because this is what we're going to use for our activity and resource information to compare the transformation from before and after. Okay, so our crew's completed their transformation, and now they're going to begin their quality assessment. So what we can see here is you'll note that we've got only our quality metrics here. This cost has been removed for the moment, so that's only at 80%. So we'll bear that in mind for the moment. We've got our value metrics here, quality metrics here. We've got a weighting that's the same. Projected pathway, that's copied and pasted from the previous tool. That's how we decided on option 2. And then now, because it's 6 weeks later, actually the transformation that's taken place may well be different than we expected, better or worse or whatever. And you can see actually we're asking the crew then to reassess the transform pathway with all the information that they've had. Okay, and then we asked them to think back, and before the Evo process, if all of this didn't happen, or we reverted back to the original pathway pre-transformation, what would we score our original pathway based on this? And these are the two key elements here. And once more, we would also ask them to look at a quality aspiration. So with a few more PDSA plus cycles, with a few more changes, what do we think we can aspire to within this specialty for as a quality aspiration? Right, that's the assessment done. And all of these scores are then put into the value impact comparison tool. And this is the final slide I can share with you today. So here we go. There's nothing new on this screen. So we've got our our quality components. We've got our metrics. We've got our weighting. We've got our original pathway here. We've got our transformed pathway, and essentially we've got the quality score, which is an average percentage based on both. Now, the resource score was a Likert scale back in the second tool, but obviously because we've done our PDSA plus cycle, the crew can then essentially extract that that information, and we've got percentage pound on budget variance, plus or minus, and we can see here in this example we've got plus £15 percentage. So we add that in and we weight that to 20% as well. We combine the quality and resource scores to produce the VIC score, value impact comparison score. And what we can see here is after a 24 week period of time, potentially you've got your director of finance, your medical director, and your board looking at up to 3 transformation statements, which indicate and contain a VIC score that, for this example, has sort of demonstrated a 35% improvement, and that factors in transparently quality, cost, risk, and strategy in its calculation. In addition, you've also got an additional 4% quality aspiration in here as well, and that's pretty compelling when you consider the use of the data. And actually, a lot of this stuff is already being done. This is just a way to give your teams evidence of the fact that they are improving not only the quality, but also the efficiency and productivity of the specialty and services moving through. I can talk a little bit about the system, but I am aware of time. So I've got a number of other slides and a few examples. There's some outcomes there. I can share the deck with people as well. And it's worth saying that we've got 4 live sites now. Lancashire Teaching, University Hospitals, Birmingham, North Staffordshire combined. And I've been speaking with Gloucestershire down the southwest as it happens. I know Johanna's on the call. I need to give you a ring, Johanna, on the ongoing EVO efforts because they took part in the pilot. So they're actually looking at considering the new model, the handbook model of EVO, and we're discussing that at the moment. If there are any questions or anything, I'm going to drop my slides now so I can see anyone. And there's a lot more detail, but I don't want to go through too much. Thanks very much.
Thank you, Richard. That's really interesting. I've got a couple of questions, and I'll wait to see if anyone's got hands up. I was interested in when you talked about the scoring for the original pathway, it sounded like you did it after, rather than before. Why is that? Yeah.
So if you imagine we're sitting down with our lovely clinical colleagues, and the first thing you ask them about their current pathway, you ask them to rate how good that looks. Actually, what we've found in a number of the pilots that we've run is they go 5, 5, 5, 4, 5, 5, because actually what we have in hand is really good, and the expectation and the defensiveness that we've understandably seen in that is actually we're great, just fine, thank you very much, and it's all going well. So this essentially runs through the process and asks them to assess it after, and generally what we've seen in the pilots that we've run, they're a lot more realistic and comparative, because actually the transformation is the thing that's carrying them through, and that's the comparator. So we thought about doing it first, but we tried it, but funnily enough, it was a little bit more defensive than we were expecting. So this at least gives a fairer comparison of both.
Yeah, thank you. And I see Michael's got a question.
Yeah, thank you, and thank you, Richard. So clearly that's this is a development of the best possible value tools that existed 2, 3, 4 years ago, and I was involved in some of the work back then, and which unfortunately stalled as COVID hit, because we were implementing something here in Dorset using that. And I particularly like the final slide, which is probably new. I don't think there was something similar in the best possible value scheme, which gives that improvement, and that I think that's really useful. My experience with what we had done so far with the BPV was the the first bit, establishing what your decision is, establishing what the value metrics need to be, and preparing all that in an agreed way for the project team was really difficult and time consuming. And I just wonder if that's similar experience you've had now. You've had some more programs up and running.
Yep. So, so for those that don't know, the best possible value toolkit is a toolkit of 12 tools that are available to freely download on the website. We've reworked them, actually spent a lot of time with them, and they've been republished in August, and you can download them as a toolkit. Within there, you're right, Michael. There are 2 tools. The first 2 tools are taken and adapted from the best possible value. The third is designed specifically for Evo, based on the fact that actually we've got access to Plix data in that. So essentially the understanding for this was that's a system level decision-making toolkit, and this is, you know, a lot more appropriate at use at an organizational level. So BPV, so yes, it focused on the decision that needed to be made. And I think, well, with the Evo process, there's actually what we've sort of formulated in is, rather than try to understand and frame the decision that needs to be made, there's some discovery there that needs to happen, and engagements put first and foremost in there. So in that first session, all that happens is we do the value metrics tool, as I've stated, but because we've got this large Plix data set, typically what seems to happen in those conversations is finance go in with this Plix data lake and swim around and talk about patterns of variation, and look at what the data is telling us all about the thing that you know best about. And actually the engagement can be quite tricky, because what a lot of organizations come to is that data quality objection, and actually a lot of the process of this just gets stalled in that data quality element, and that's a real challenge for progress. So in becoming aware of that, essentially we've refamed Evo to be as lean as possible. So you remember so in markers 1, 2, and 3. So marker 1, organizations that, or teams that don't manage to get to the hypothesis quickly, actually generally what the challenge is data quality in that. So there's a lot of content in marker 1, which is the content for the session, the third session, all dedicated to data quality, and it takes teams through that journey of sort of accepting, yes, the data quality is where it is. Will that change your conclusions or your ability to draw conclusions from the data you have available? And that's a really important lesson that can be stuck. So moving back, and that's a bit of a segue. So in the first session, the only other thing that happens is we don't start with data at all, or a decision at all. Actually, we sit there with the aim about improving the specialty and service quality of resources sustainably. Great, that's it. And then everything becomes about talking and sitting down with the clinical teams and asking them to talk about their specialties, because actually a lot of this stuff, and come up with 3 hypotheses for transformation. That's it. There's nothing more that takes place in that, and that hypothesis, direction, and prioritization forms the whole arc of the whole journey. And actually this is the decision-making process. So arguably you could even do some of BPV after Evo even takes place, right? So this hypothesis and targeting things on hypothesis, actually some clinical teams have never had those conversations with finance where they've just been asked to talk, you know, as the experts in their field, talk about their hunches. And we know clinicians have this is low-hanging fruit, isn't it? It's not like they're going to have to we provide a lot of resources in order for them to be able to do that. So there's an anonymous data capture from sort of the janitor right up to the head of the clinical service for each specialty. We provide that as a tool, so that can get circulated before the launch, so they've got a lot of fodder, as it were, to crack on with. But ultimately all they need to come up with is 3 things that they think will positively improve the quality, and then finance go away, get the data and evidence for it. So we have found in the BPV element that finding the decision and wrestling the decision is a really challenging component of it. So actually what this is about is asking the experts in the room what their assumptions for change are. And then because we have that data, that timely data, and we're going to be able to compare it before and after, it becomes more about that. Now the decision itself then comes after, and it produces ultimately that decision by leading with transformational change. Sorry, there's a lot of detail for those who don't know about BPV there, but there's I hope that's at least helpful, and I'd be really keen to chat with you, Michael, offline about your experience of that framework, because we're looking hopefully to In the interim, before we can get Plix data up to the systems and ICBs, to be able to do a much leaner version of BPV centered around hypothesis, that will be in a little booklet rather than a large project management thing. But I'm working that up hopefully over the next 6 months. But I'd really value to talk to you about that offline. Is that sort of broadly?
No, that's really helpful.
Helpful?
Thank you.
Okay.
That really frames it well. Thank you. And yeah, very happy to be involved. Really keen to continue
Fantastic.
to be involved. Thank you, Richard.
Thanks.
Have we got any more questions? I mean, one thing, Richard, it'd just be helpful if you've got a really good live example of something that's been done, just to sort of, that one of the real successes and how it.
Yeah, so from the pilots, we had North Staffordshire combined, which is even trickier in mental health. So it's really important to have those examples, because the assumption is, even if acute might be able to do it, there's no way mental health will be able to. But yeah, North Staffordshire combined ran through the pilot, and they completely redesigned their adult memory service clinic. When I circulate the slides, I have that in the back of the deck. So when you get the slides, have a look at those. I won't go through them now. I think we're a bit short on time. Ultimately, they ended up redesigning their entire adult memory service clinic, and improved. There's a lot of numbers on there, so that's good. So there was a significant output and cost saving there, that they've mapped. And they also actually, the clinical and the Evo team there, so Nick Wildin and Dr. Becky Chubb, won Royal Psychologist Team of the Psychiatrist Team of the Year award for that work in that redesign over COVID. So the successes are there, and I guess the principle of value-based healthcare is we focus on the quality and the costs fall out, right? And what we're seeing in a lot of the evidence nationally and internationally is that is the case. However, it's just quite a challenge to be able to start measuring quality outcomes, because and it has been historically, because organizations are very set on trying to set a quality outcome as standard for every single specialty and everywhere. And we know in the NHS that there's such a high level of variation. How can you compare apples and oranges through all of this? And that's where sort of quality outcome measurement has become a difficulty. In Evo, we just asked them to define what good looks like in their own isolated instance for that 20-week period. They're the experts in that room, and they can use that to assess what is good and what won't be good during that period. And that's allowed us to open up and start using a measurement that's quite effective. And Linda, I'd love to, if we've got 3 sites at the moment, they're all completing October, November time later on this year, and we hope to whatever degree they'll have VIX scores, etc., moving at that time. So I can come back with or without them, but with their scores and how they got on through that. It's early in the process, as it were. So we're waiting for the evidence of the VIX score, because that's a new tool component to this.
Yeah, no, it's absolutely fascinating. I think what the bit that's interesting is, normally as finance, we normally think quality costs. That's sort of like a perception. So it's really, interesting that it's showing that doesn't have to be the case. So that's really good stuff.
So that links in with sort of the waste reduction methodology in Virginia Mason and this sort of stuff, in the sense that the understanding is that within any healthcare organization there's sort of 30% waste there. We've found that and it's just identifying that waste. And now, funnily enough, we found that talking about waste when you go into a clinical meeting for the first time is probably not the most engaging, positive language to use. And if the spreadsheet's not going to switch off clinicians, definitely going in and talking about their waste when they're saving lives day to day is not going to help the factor either. So adding value is just a more positive way to talk about this. And so the principle of improving care for the patient, they want less contact, less messing around, less wasting of resources, obviously, because they want a leaner, more efficient process to happen to them. They want good healthcare. That actually reduces cost. So the evidence is there, but it's being able to evidence that, and that's why Plix is so powerful at the organizational level, because we can press go every quarter, in some cases every week, but very few. This is the purpose of that data set. It's not reporting, it's not, it's for improvement is our view anyway. And if there's an easy enough model, it can be used very powerfully to demonstrate this stuff that actually trusts are doing all the time. We just don't have a way to articulate those things.
All right, thank you. It's fascinating stuff. So I'm sure maybe in the future it might be helpful that you come back. But you're going to circulate the slides, yeah? And
I'll
will
send me
it have the
slides. I'll
link?
share me contact
Will it
details
have
in the chat.
yeah, the
And
links to the,
and what I would
yeah.
ask from value makers is, you know, sign up. It's going to be great. And if you've got any questions, give us a shout. Also, so what I'm doing at the moment is I'm being sort of dragged in sometimes with no idea who's going to be I'm speaking to, but essentially it's not up to you to run to your DOF and your medical director and your board to go, we should do this. We're offering support in building a case for you to be able to get this stuff and get that protected time. Getting the protected time is the hardest bit to do this good stuff. And I'm having ongoing conversations, and I'll have a go at convincing anyone that this is the right way forward. So please get in touch. I can work with you on that, and try to get that mounted in the organisation. You know, worked well so far in the last 4 months with those 4 trusts. So we're getting there. Michael, is that a legacy hand or?
That was a new question, if you don't mind. And
yeah, of course.
a little bit of a challenge. So as you say, PLIX is essential to the approach and working trust. So how would we take that approach and apply it in primary care, where the data is not so well constructed, but potentially there's lots of opportunity?
So that's okay. So that's the system question, isn't it? So it's part of the roadmap. I don't know I've met anyone who wants to try and stitch together PLIX and primary care data yet. So what we're looking at is the objective here, isn't it, is to be able to make decisions as a system that affects entire care pathways and improve the health of the population. That's the ambition. Sustainably. Brackets, yes. So in order to be able to do that, we do need data, and timely data that is updated. So as a first step, rather than trying to boil the ocean, what we're trying to do in Evo is there is a data set that can be updated timely, and if we can gather secondary care into a position where they're using one language of improvement, and that's consolidating and bringing together cost improvement and quality improvement into one as value impact, but also bring together all those data sets. So there's an ICS up north which have a view of all of their PLIX data for all of the trusts in that system, and that's updated quarterly. Now that's extremely useful for an ICB or provider collaborative to start making system decisions. Yes, it's only secondary care, but shouldn't we as providers try to get into a position where we have at least the same data in one place, and then we try and merge different data sets and build that out? There's a center of data intelligence that's needed in systems. Getting there is really tough. Caldecott, data sharing agreements, all of that really tough stuff, but trusts are doing it. And so in answer to your question, I have no idea how we're going to stitch together primary and secondary care data, Michael, sorry. But let's work to, you know, Evo is about trying to get people to the same central place, wherever that is, with and agreeing on the language that they can, you know, improve with, and try and consolidate at least a single data set into one first. Then we can start talking to the GPs and see what they got. But at least that's going to be better than what we have at the moment, or many systems have at the moment, which is, you know, very fragmented data to be able to inform improvement. So it's not really an answer, but it is the answer, I think.
Come and talk to us in Dorset, because we have a really good integrated data set across primary, community and acute care. That
have you got council
working on it? Some.
Oh, that is interesting. Yes, please.
Yep.
Yeah, great. I'm looking for a trailblazing site that can do all those three. I've only got interesting. Yeah, all right. I'll give you a shout. Thanks, Michael. You might regret that, but I'll be knocking on your door. Thanks very much.
Oh, thank you, Richard. Your passion for this just really shines through, really, and so really appreciate you coming to talk to us. So I'd say thank you. Really fascinating. So sounds like you've got some work that'll be happening with Michael. So that's great. So thank you very much.
Thanks.
Okay, so I think in terms of the agenda, we're on AOB. So I don't know if anybody's got any AOBs that we're aware of. Haven't seen anything in the chat. Aoife, do we know? Is there anything come up?
No, I don't think so.
Okay, all right then. So can I just say thank you to everybody for coming. It's good to see lots of faces. So and when's the next meeting?
Let me just have a look for you. 2 seconds. So the next meeting is the Thursday, the 14th of November, 11:30 to
Yeah.
or 11:30
Okay.
to 1 o'clock. So I'll once
Brilliant.
the agenda's ready for that, I'll circulate the booking link to everyone so they can book on.
Yeah, thank you very much. So thanks everybody for your time today, and I hope you all have a good summer. Okay, all right, take care.
Thank you.
Bye bye.